Portals for
Mhm.
bliss, orgasmic bliss.
Yeah, and you and I both deal with very specific parts of that portal, but it's all about our connectivity with our fellow humans.
Yeah.
And when you're close to somebody and you want that intimate relationship, truly there are endless ways.
Hey everyone, welcome back to the Pelvic Pulse podcast. We have our third repeat guest. So, Dr. Sharon Dickerson was on season 1, episode 21, and I'll just share a little bit about her. Dr. Sharon Dickerson is a trauma informed biological dentist with over 35 years of experience dedicated to transforming not only her patients' dental health, but also their overall sense of well being. Her journey into holistic care was born from a personal health crisis early in her career, which she did talk about in the first episode, when mercury toxicity from her profession led her to reimagine how dentistry could truly serve and heal. Dr. Dickerson's approach is rooted in meeting people human to human, offering a level of compassion and loving care that is increasingly rare in medicine. So true. She believes that trust and connection are the foundation of every transformation, empowering patients to reclaim their health with confidence and hope. With a focus on TMJ and TMD treatment, mercury removal, and biocompatible care, Dr. Dickerson blends cutting edge technology with a heartfelt commitment to personalized, patient centered care. Whether restoring balance to a bite or addressing deeper systemic health issues, she takes joy in partnering with her patients to help them feel seen, valued, and supported. For Dr. Dickerson, the greatest reward is walking alongside her patients on their journey to healing and witnessing the profound impact of care that prioritizes both the body and the soul. Welcome to the show.
Thank you, Brittney. That's beautiful. It's so good to see you again
I
and be able to
know.
chat.
I know. It's so, so good to have you here. And I mean, it is under probably not the most favorable circumstances on my end. However, I feel like if I can share about my personal journey with some dental health issues, I think it would open up a world of conversation for people to make these connections that they might not have otherwise made. And I feel like
Yeah.
someone that, you're someone who probably actually hears maybe a lot about certain things that people experience when they do have dental trauma or jaw
Yes.
work or all of the things. And so, I mean,
Mhm.
truly, I don't want this to be a uh, like no such thing as TMI in this episode. So I'm kind of
Yes.
excited to go there with you today.
Yeah.
We didn't really get to touch on it so much last time, but yeah, I'll just share a little bit, I guess, about what
Please
happened
do.
recently. Yeah. So we're recording early February, but back in January 16th of this year, so just a few weeks ago, my dog jumped up and bumped me right in the mouth. And that was early in the day. And I was kind of, felt like an ambush to my face.
Yeah.
And I thought I was going to get a bloody nose. I thought I had broken my nose or something. I I didn't hear anything happen, but I went and looked in the mirror, looked at my teeth. Everything was fine. Then later that day, I was sitting down at my computer and around like 3, 4 p.m. and I was typing and I just slicked my tongue across my teeth and I could feel this unevenness, like chip.
Hmm.
And I go and look in the mirror. And this time, for whatever reason, I was like, I'm going to put a flashlight behind my mouth and see if I can see through. Sure enough, there was a deep, deep crack in my
Hmm.
16-year-old crown from
Mm.
basically bottom to top. And I freaked out
Mm.
because what the last time I had any kind of real dental damage, dental work done was 16 years ago in college. I was a sophomore doing some human bowling
Human
And
what?
that's literally always the response. Human what? Bowling. So the human is
Okay.
the ball, and there are inflatable pins at the end of a long
Oh,
aisle.
okay. All
Yeah,
right.
yeah. So
Yeah,
there
okay.
are
Not recommended for dental health.
no, yeah, it wasn't regulated. It's kind of like
Right,
a
right.
glorified slip and slide kind of
Gotcha.
thing.
Yeah.
Which
Great college trick. Yeah.
never do. Yeah, never gonna do that again.
Uh-huh.
I ate it first
Oh,
into the floor, face first into the floor, tile floor, and I fractured my 9 and 10, so my
okay.
front teeth off to the left,
Hmm.
and it was pretty bad. So I had first a temporary put on for both, I believe. Yeah, both. And then over the years, it took about 2 years to kind of come to a completion of the work that I had done. I had to get
Hmm.
braces to see if they could save the short tooth
Hmm.
and pull it down. And then eventually I got root canals. One root canal didn't really stick, so for the short one, there was some resorption up in my root, and so they had to pull that, and I ended up getting an implant. But at the end, I was so grateful for that work back then that was done. I
Hmm.
thought that I would be able to keep this going until way later down the line. Like
Hmm.
maybe I wouldn't even have to get it done until the middle of my life, and maybe
Hmm.
maybe one more time in my life was what I was thinking. So when this happened with Kita and I had this realization, oh my gosh, is this time to like redo this?
Hmm.
And luckily, I have a friend who works at a dental office. She's a dental hygienist, and the doctor she works with is pretty amazing with his crowns and veneer work. And luckily, he doesn't see patients on Thursdays. And so he said I could come in, and I got to see him, and he took a look, said it was basically an aesthetic thing, really. They polished it up and got rid of the chip. And I mean, there was obviously the option to have it redone. And I decided to put myself on the schedule just in case. And over the weekend, I ended up getting another chip in the tooth up at the
Hmm.
top and while I was flossing. So that was unfortunate. And I'm like, okay, well, now there's a hole basically
Hmm.
in this tooth. So I'm glad that I had it on the schedule. So currently, as I sit here right now, I have
Temporary
next,
what?
my temporary crown,
Crown. Okay.
uh-huh,
On a root canal.
on a root canal tooth. Yes.
Okay.
Yes. Yeah. And then I'm gonna get my permanent one next week.
Okay.
But yeah, as I was going through this, I was messaging Carly, your daughter, who we both love, obviously.
Right.
And it was just so crazy. After the first appointment where he just polished up the initial chip, I was flashing back to how I felt in college and how really I mean, I can go deep like right away into the root of what it was I was feeling, and it's like I'm not lovable.
Oh my goodness.
Yeah.
Isn't that crazy?
Yeah.
I had an injury to my front tooth and now I'm not lovable.
Yep.
Hmm.
Yep. And there was like a lot of shame
Hmm.
around it. There's a lot of I guess the lack of confidence I was reflecting on that I felt in college was kind of coming back up again. And so, I felt so sorry for that version of me back then. And I'm grateful that I am where I am right now in terms of my embodiment. And I am grateful that I can sit through some of these processes and really
Hmm.
face these, not realities and actual truths about who I am, how lovable I am, and all the above. I remember I called my dad right away after the dentist this time. And I just
Aw.
sobbed. Yeah. And he was so sweet and held me in that and just assured me that everything was going to be okay. And
Mm-hmm.
I mean, he didn't say it wasn't a big deal, but he made it feel like it wasn't going to be that big of a deal and I was going to
Sure,
be able to handle it, which was, yeah, reassuring.
for sure.
But isn't that insane that, I mean, I'm sure you can speak more to the impact that someone's smile can really change their confidence
Mhm.
and their outlook on themselves, you know?
I think our bodies are really in tune to any injury.
Mm-hmm.
I do think there's something uniquely poignant about a dental injury compared to stubbing your big toe,
Mm-hmm.
which hurts. You have to deal with it. You have to mount an inflammatory reaction and heal it,
Mm-hmm.
but nobody's going to really see it. What we know is that the neural input to the
Mm-hmm.
teeth is so close to the brain through this huge fifth cranial nerve that is really intertwined with a lot of our emotional reactions and how we perceive the world.
Mm-hmm.
So you picture an infant, and one of the first things they can do that the parents are so proud of is take something and try to put it in their mouth. I mean, there's so much allocation of our nervous system to our mouth that it makes perfect sense to me that this would be a poignant injury to you.
Totally. I'm glad you named the nervous system thing because
Mm-hmm.
one of my first realizations in witnessing myself through this process again was how my nervous system was on total sympathetic, total fight,
Mm-hmm.
like total
Right.
flight. I was hyper vigilant of anything, anybody, even now to this day, sitting here.
Mm-hmm.
I'm very wary of my surroundings. I don't want my dog really near my face unless I have her pinned
Mm-hmm.
down, kind of like just holding onto her collar. And even my partner, James, if he's sleeping next to me with his hands behind his head, his elbows are kind of by my face, I'm like, nope, put those arms down. Like I can't
Right.
have an elbow by me. And I feel like I'm dodging all the things and I haven't I haven't yet. And I don't know when that changed for me the first time all this happened, where I could finally feel at ease and relaxed
Mm-hmm.
around things going on in my mouth. But
Well,
yeah,
have you ever seen the Homunculus Man graphic?
yes, yes. But
So
tell
there's
everyone about it.
a an amazing amount of our nervous system allocated to the part of our body that is our tongue, our face, our lips, because we know from our genetic ancestry that this is critical to our survival.
Mm,
So, to propagate our species, to stay alive, we have to have a functioning mouth. We have to be able to breathe. Now, in this relative modern physical body that we're in, we speak, we take in nutrition. This is how we eat, breathe, and speak. What could be more fundamental to our survival? So I think you're just experiencing a very, normal genetic human response to this trauma that this has to be protected or I won't make it.
right.
Now, granted, we can't discern in our brainstem degrees of, I guess, threat
Hmm.
from our to our whole environment, but a chip in a tooth is something your body knows. Okay, radar, radar, warning, warning.
Right.
Carly's sister, Casey, this is just an example, but she was a 14-year-old middle school kid, and I was at work. I'm a dentist, she's in middle school. My front office knows not to contact me about anything my kids bring in unless it's urgent. Like, so this kind of trained my kids to not call me for little random things.
Mm-hmm.
Well, she called my front office person. It's like, I have a hideous broken tooth that my tooth broke. It's terrible. I can't go to volleyball practice. Mom needs to see me at the end of the school day, and we canceled everything. And somehow Casey got to the office. And I'm not kidding you, Brittney. The chip was, I couldn't, with my magnification loops, I could barely see it.
Oh my gosh.
So my point on that is that maybe it's hard for our whole body to know what's a huge threat and a nominal threat, but we know that when a tooth is injured, it's a threat.
Totally.
So you're still in some survival mode, and just good for you. Your
Yeah,
body knows to take that. So,
exactly.
mhm.
Exactly. I mean, for me too, and with everything that I know about the facial bones and craniosacral work, I mean, I could feel every little like nasal bone, my facial bones, like even up into my orbital.
Mm.
I had a pretty gnarly headache the rest of that
Yeah,
day. And my mouth was obviously really sore later when I got my temporary. Oh my gosh, when they sawed my first crown in, they just chipped it off over time.
yeah.
And it was the first time I'd seen that tooth for a really long time. And it was just crazy. I mean, I'm glad it looked
Mhm.
healthy and all of that. And like, luckily, the actual tooth wasn't cracked underneath the crown or anything like
Mhm.
that. But yeah, like my gums, like everything in my face are so sensitive.
Right.
And you know, I am really grateful. Actually, like I'd love to speak to maybe the approach on entering someone's mouth. And I'm grateful that this particular office did a really sweet job of letting me look when I wanted to look,
Yeah.
like me telling them, okay, like, yeah, you can do that. Yeah, yeah, I'm ready for
Mhm.
this. Or like, ugh. Literally, the hygienist or the assistant actually held my hand during one
Mhm.
part when she was injecting me with the numbing agent.
Yeah.
I was like, oh my gosh, this is so nice.
Mhm.
But yeah, I think it makes also a world of difference. Um, and not to turn it into a funny, but I was watching Kate McKinnon, old SNL skits with her, and
Yeah.
I don't know if you've ever seen the one of Close Encounter with the abduction, the alien abduction,
I
but
don't think I've seen
she
that.
she did a second one, and she calls it her coot coot, but down low she calls it her south mouth.
I
I
love that.
I got a kick out of that. But
Yeah.
in reminding me of, the really sweetness, the compassionate slowness, the trauma-informed care of entering someone's body, whether it is south mouth or actual mouth,
Mhm.
is also so key and
I
probably
totally agree with that. In
life-changing.
the realm that you work in is probably a primary private part.
Hmm.
Maybe the oral environment is a secondary private part. I don't know. It might be a tie, but um
I agree.
yes,
I
it
think,
is an entryway to the body
mhm,
that is your body. And for anything to come into it, ideally is with your permission.
yeah.
Mhm.
So, on that kind of note, another thing I recognized was how I can't even remember if in college, I was really reflecting on my sexuality, my expression of sexuality based on my confidence and based
Mhm.
on where I was in my healing with my mouth.
Mhm.
I definitely made out with people with braces,
Oh,
but
who didn't? Yeah. Oh my God, the
but
lip tangle and
I know.
yeah.
When I had braces, I think, I don't know, it was probably a really low number, like under a handful.
Hmm.
Because it was only for a year. But I do remember feeling, especially when I had my flipper while my gums were
Hmm.
healing. I don't think I wanted to give head,
Mm-hmm.
which another thing I was thinking about with this new thing, and like I already said, feeling hypervigilant around whatever comes close to my mouth.
Mm-hmm.
I don't feel the urge to give head at all. And I could also imagine that you've had many clients who have had all kinds of experiences, whether it was dental trauma or other sexual trauma.
Mm-hmm.
But yeah, like entering someone's body with consent is
Mm-hmm.
of the utmost importance. But I was reflecting on it more and thinking how incredibly wild that, you know, someone's dental well being
Mm-hmm.
is absolutely impacting their sexual expression.
Well, I think sometimes because we have genitals, we forget that our oral environment is really right up there with intimate contact.
Mm-hmm.
That's usually where we start, honestly. Okay, a hug,
Mm-hmm.
then kissing.
Mm-hmm.
And I think that when you're in a little bit of fight or flight relative to the health of your oral environment and the integrity, because you had a damage, so there was a little bit of integral loss of structure.
Yeah.
You just don't feel like, intuitively that it's whole
Mm-hmm.
and can receive and give until it's healed.
Right.
But
Right.
here's the beautiful news, Brittney, is that bodies do heal.
Yeah.
And we live in an era of modern technology where even if it's artificial, you can become whole again for function and for beauty.
Mm.
And it might take a little bit of time, but it doesn't take forever. And before you know it, that trauma, because you're acknowledging it and because you're dealing with it, it will subside. And
Mm-hmm.
you sounds like you have immense support on your dental team,
Mm-hmm.
which is great. Um, you weren't made to feel bad. You weren't rushed through the process or shamed through the process. So,
Oh my gosh.
I mean, I don't know if it'll be days, weeks, months, but you'll feel normal
Yeah,
because you can heal.
totally. I of course believe that wholeheartedly, but it
Yeah,
is like when you're in the middle of the whole process.
I know.
It's like when you're sick, you're like, am I ever going to be healthy again? Like you
Yes.
can't breathe, you can't take a breath in without coughing at all, you know?
I
Those
think I know.
moments.
But it's like when we have pain of any kind,
Yeah.
it's the pain that's problem, but it's almost the fear of, okay, so this is my life now.
Mm-hmm.
I
Mm-hmm.
don't know if I can do this.
Right.
And it's a big override intellectually and emotionally to say, no, this is a temporary condition,
Yeah.
which
Yeah.
I think is kind of where our culture has adopted techniques like pharmaceutical interventions and opioids and things that short circuit
Mm.
that pain response. And in some ways, it's a godsend. In other ways, I think it's a disservice because in our natural course of things, it's good to learn
Right.
that injury, pain, if it's not life threatening, with proper help, will heal and you will
Right.
get to the other side.
Right. Right.
Mhm.
It's like it is a message to listen
Yeah.
to. I think, yeah,
Hmm.
definitely to be able to manage it, especially when it's inside of you.
Yeah. But the mouth is like inside and out.
Mm-hmm.
It's the window.
Mm-hmm.
Um, there's a lot of real estate that has access from the outside, and that's how we intake our nutrition and our air.
Hmm.
And um, so, yes, it's a very unique bridge.
Yeah, totally.
Mhm.
Like, what I guess I'm curious what you would say for someone who experiences sensitivity to their teeth or
Mhm.
their jaw,
Mhm.
especially when potentially, let's just say, as an example, performing sexual activities
Mhm.
or just being sensual, you know,
Mhm.
wanting to enjoy food without pain.
Yeah.
You know, what would you say to them?
We all have adaptive mechanisms.
Mm,
So when one pathway is not ideal, our body has all kinds of other ways to short circuit that and go to another route. But you can't avoid needing to eat and chew and sexual contact. It's all part of humanity. So I think we hold ourselves to some kind of standard
mm,
as we do in so many facets of our health and our identity that is based on cultural norms of this era of what makes high performance on a sexual front, on a intimate contact front, on okay, even just in taking food.
mhm,
But that's not necessarily in itself critical to our survival.
mm,
You can adapt to a lot of things. In so many people have different physical, I don't even want to say limitations, variances that cause us to reroute
mhm,
and find other ways. I remember when I was able to do mission work in Honduras, and I was in a population that isn't privy to a lot of the medical advancements that we have here in the United States. And you would see people with deformed limbs and with facial misconfigurations, and they somehow figure out how to just limp along. And their society didn't seem to think less of them.
mm,
So I guess my point is that yes, sometimes our struggles that aren't the optimal ability to open our mouth the widest or just bite off the biggest apple in the world. You know,
That's a trigger for
um,
me to see people bite into apples. I'm like,
is it
no. I get
because of your
jealous.
front teeth?
Yeah,
Oh yeah,
I'm deeply jealous of
yeah.
people who can do that.
Well, good for them.
Yeah,
And
let
then I
them.
bet they would say to you with things you can do that they can't, good for her.
Yeah.
So sometimes it's a matter of acceptance. Now,
Yeah.
if there's medical advancements that can help improve these things incrementally or grossly, awesome, go for it.
Yeah.
But sometimes the limitations are what they are.
Right.
Um, Gosh, I just saw this Instagram of this amazing gentleman whose name I wish I could think of, who doesn't have arms or legs,
Mm,
but he has hips and he moves through the gym on his hips fast. He's like boom, 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 boom. And he comes up to the camera and he's like, don't give up on yourself. You can always achieve your best.
mm,
And he's fit, like you can tell. His cardiovascular system's running. He's handsome. He's awesome. And I was thinking, wow, and I'm complaining about the fact that I can't eat a Jolly Rancher.
mm,
Um, I think there's limitations to being in this human body that are just a part of our journey
mm.
to learn acceptance and then enhance what you can.
Yeah, I think those two
Hmm.
words that I heard from you, acceptance being one of them,
Hmm.
is a big one. I think accepting where you're at right now in the healing journey. So I'm talking to myself
Hmm.
here.
Yeah.
Accept where you're at, Brittany. But then
Hmm.
adaptability being the other one
Yeah.
and finding these new pathways of expression
Hmm.
through the mouth, through sexual front, like you said. It's,
Hmm.
I mean, I talk about that all the time. Let's redefine sex for you right now.
Right.
You
And
know?
what a gift that we have so many portals.
Yes, yes, truth.
Yeah.
I love that you call them portals. Portals for bliss, orgasmic bliss.
Yeah, and you and I both deal with very specific parts of that portal, but it's all about our connectivity with our fellow humans.
Yeah.
And when you're close to somebody and you want that intimate relationship, truly there are endless ways.
Yeah. Yeah.
So if somebody's being, feeling inept because there's one of the, let's say, 100 pathways that's not ideal right now, that's a great opportunity to say, all right, let's enhance some of these other ways because
Right.
it's just life.
Yeah, totally. I mean, I'll give
Hmm.
an example that I can think of right off the top of my head, personal experience. My mouth was bothersome, the
Hmm.
day after I had the old crown taken off, new temporary crown put in. And yeah, I'm feeling so vulnerable and so
Yeah,
uh not ugly, but definitely just like can everyone tell? Like of course, it looks so different to the person who's got the thing
right.
going on and it feels different. But I asked James, can you give me a face massage and just
Hmm.
scratch my head and, do behind my head and neck, being in the chair for a little bit was not,
Hmm.
I mean,
Sure.
it's fine. It's comfortable and whatnot. I'm not complaining about the experience really,
Yeah,
actually, but, just feel tense.
for sure.
And in the area that I'm actually so sensitive in, he stayed kind of away from like my muzzle.
Smart man.
Yeah. But he has really nice strong hands. So he gets into my head, pulls on the hair
Hmm.
a little bit where it just needs that and
Hmm.
it's another expression of love and sensuality and expression or
Yeah.
yeah. Yeah. It was so nice.
So that interplay between the two of you is really what it needs to be.
Right. Because
And
truthfully, like I don't feel comfortable yet, like fully making out kissing, you
right,
know? Like we'll do
a little,
yeah,
yeah.
like keep my lips far off of my teeth.
Luckily they can stretch. Oh my
Exactly.
gosh, that's funny. And as we age, if you and James are partners over a long period of time, you can't even imagine the iterations of
Oh.
how you're going to nurture each other and
Mm,
help each other out.
mhm.
So I'm glad that you could ask for what you needed and that he was right there. And you're going to heal. And don't, discount the fact that yes, your tooth was a glaring, I guess, target,
Mm,
but the trauma
mhm.
wasn't just your tooth, it was your whole face.
Right. Yeah.
And think of like the crash dummies in those experiments they do to test the safety of automobiles.
Right.
And that, yes, that person might walk away feeling like, oh, I hit the airbag and it smashed my face. But there's a whole host of reverberations. And, your head probably did a little bit of a dance while you hit that trauma. And yes, your tooth was part of it, but it's your whole face, which guess what is right next to your brain, right
Mhm.
next to your eyes, your nose. So much neurological innervation and feedback to your brain.
Yeah.
That's like, okay, this needs to heal.
Totally. Totally. I just do like very light touch on my nose and when I was having the headache, just slightly underneath my eyebrows
Hmm.
and feeling the lift like off of my head just to give myself some space.
Yeah.
So helpful. And then I can
Hmm.
I can tell all of these connections that you're speaking to. I can tell when I do my gua sha practice
Hmm.
in the mornings, you know, any tension that I have
Yeah.
lingering around my mouth. Yeah,
And are
it's
you working to release it with your gua sha? Is that what you're saying? Yeah.
yeah, yeah,
That's
definitely.
awesome.
Yeah,
Then, because of your intention, hopefully you don't have latent long-term PTSD.
totally. Do you see a lot of
Um,
people with PTSD to the mouth? I'm assuming you do.
yeah, certainly do. Sometimes it's not even a cognitive thing they can identify.
Mm,
They just know that the whole process of somebody entering into the space of their mouth is danger, danger, danger.
mm. And does that ever, I'm like wondering if it ever becomes unsafe for you to be working in the mouth? Like, what safeguards even do you take to? That's a really strange question, but it's like I find dentistry so fascinating nowadays.
Hmm. Yeah.
But
Well, typically, most people, by the time they get into a dental office, are really trying to accept help.
yeah,
So then it's just a matter of communication.
yeah,
Once in a great while, there's just a response that they can't control. I mean, any dentist that's been in it for a long time has had their fingers bit.
yeah. I was basically asking that. How many times have you had your fingers bit
Yeah.
from a PTSD
You know what
patient?
I've learned is teeth are sharp.
Oh, I know.
I
I
mean, we
had,
look at them and they're like they look dull, but they're very sharp.
right,
Um, but for the most
probably,
part, you have to get a chance to have a level of trust.
yeah,
And then when the trust isn't violated, we build on that and you build and build so that then ultimately they know that we're not going to be adding to the trauma. I
right.
sometimes think of it like any other toxic exposure. Like, let's say you have your body's loaded with toxins related to a mold exposure. You can go through all the detoxification to the nth degree, but if you're still in a mold infested environment, the influx isn't going to counteract the detoxification.
Mhm.
So to me, the very first aspect of really short circuiting post trauma is to not add new trauma.
Mm-hmm. Agreed.
So
Agreed.
even though sometimes what we're charged to do as dentists, you have to use a needle, you have to use a drill, you have to use things that aren't comfortable.
Mhm.
But that doesn't mean they have to be traumatic.
Agreed. And they aren't
So,
if used
right.
well.
And if done in a supportive environment and
Yeah.
acknowledge with respect, acknowledging and accepting this is going to involve a little bit of physical discomfort, but we're here and you're here and we're here together. And this is not an abusive situation. This is a
Right.
healing situation.
Right. Yeah. 100%. I think that
Mhm.
differentiation is so important for the nervous system to take in.
Mhm.
Like, hear it,
Yeah.
feel through it.
And what I've noticed is that with enough exposure to new mapping,
Mm.
new brain mapping, people can truly overcome their past trauma. Um,
Of all
and then
kinds.
we can, this is my ideal scenario. It might sound pie in the sky, but I've had it many times where at initial contact, it's very difficult for anybody to even be in a room with me, let alone open their oral orifice
Mm-hmm.
and submit to me looking in there. And then with a due process of respect and stepwise procedures and elevated consciousness, we
Mm-hmm.
can get to a point where they're completely comfortable
Right.
and they know that I have their best interests at heart and they know that their needs are going to be taken care of and that they can call it if they're having an issue and that it's going to be respected and that they're safe. I guess that's the bottom line.
Totally.
And
Agreed.
that's true. To me, that's what a healer, like I know you are,
Yeah.
ultimately attests to.
I mean, yeah, it's like, we read this in your bio, just how that kind of care isn't really found often in the medical
Hmm.
realm. And as you're speaking, I'm just nodding my head to it, agreeing, yes, this is how my work is as well.
Yeah.
Specifically, yeah, doing the South Mouth. But,
Yeah.
it's like I wish that all kinds of healthcare practitioners,
Hmm.
anyone who considers themselves a healer really does approach the person human to human, like you wrote, and really with that knowing that we want what's best for them and we'll
Hmm.
go and meet them where they're at,
Hmm.
hold their hand through, and
I
we're there
think
every
it's
step of the way.
emerging, Brittney. I really do.
I do too.
I don't know if it's emerging. I think we're just remembering.
Yes. Yes, Dr. Sharon. That's actually, I did a meditation this morning, guided from
Mm.
a new guide for me, and she just, as we were shaking up stuff, she said, "We're remembering. We're not necessarily
Mm-hmm.
creating a new idea
Right.
necessarily, but it is about coming back home, listening within,
Mm-hmm.
and yeah, remembering that this is a way of treating other humans."
I think that you or I probably can't possibly know the historical steps that led us to abdicating our health to an outside source.
Yeah.
Some
Yeah.
people have given a lot of their time and energy to trying to map that out. And when did the body become segregated into these parts that
Mm.
led to these specialties
Mm-hmm.
that don't acknowledge that it's part of a functioning whole organism,
Right.
spiritual, functional, metabolic, all the facets of our physical beings. But I don't think it's uh, far away from what we actually know
Right.
as far as total healing. And so to me, the fun part is just really opening up and getting back to that. And then we all have, if you're in a technical medical field, there are certainly things we train to do that are meant to help people.
Mm-hmm.
And healers of age in the past times, God only knows how they got all their information. And the ones that were true sages and were out for the improvement of the health of their entire tribe took in input from all kinds of sources.
Mm-hmm.
And they weren't segmented into a silo of this is the right way and I'm an authority. I'm going to tell you what you need. Um,
Yeah.
I think true organic healing uplifts everybody.
Agreed. Agreed. I was gonna say that, I mean, part of my practice, and I wonder how you would layer this with dentistry in your work, but speaking to the authority and handing it over to someone
Mm-hmm.
else, right, who might know better, who went to school for it, blah blah
Sure.
blah. My practice is, okay, let's get you touched into your own intuition. So another version of
Mm-hmm.
remembering, right? What's actually going to serve you? What's here? What is your body actually asking for in this moment?
Yeah.
And yeah, like I wonder how you play with that within your practice, and what you see with people, I guess, being able to uh, connect the dots.
The challenge with the oral environment, as you may have pointed to with your own experience, is that somehow it's a part of our body that is famous for us being disconnected from. So, what I find psychologically on that is that sometimes there's a barrier of denial.
Mm,
So, you mentioned whether it was today or in a past correspondence that you also were suffering some kind of on a self-esteem level or some kind of a level of my appearance.
mm,
And there's a lot of our identity that is wrapped up in our mouth. It
mm,
is our front facing, ever changing nuance of expression. Now, granted, our whole face is like that, but the mouth is a big one.
mm-hmm.
But unfortunately, for whatever reason, I don't think in my lifetime I'll ever understand. We've gotten a little bit shut off. I can't imagine it's much different from our pelvic area.
Mm,
If it's not on your forefront consciousness, you're disconnected.
yep.
So I feel like sometimes I'm doing a dance between helping people accept the current reality with love and respect. And sometimes just to be honest, sometimes there are huge barriers. The
Yeah.
current reality is something so scary and detrimental that there's like a huge barrier. And my hope is that we can gradually take down that barrier. Sometimes I can, sometimes I can't be a partner with that. But
Mm-hmm.
when we can, then it's a matter of you have to look at the current situation in order to know what's not working, what is working. So if somebody has an intuitive sense when they truly understand the whole picture about what's most kind of like the most raging fire for them, their psyche, their health,
Mm.
all things being equal, I'm going to say, well, then that's where we need to start.
You know what I'm thinking about
Hmm.
as you're speaking and sharing? I'm thinking about the phrase, how you do one thing is how you do everything. And so
Yeah.
the denial of maybe anything that's going on with your mouth, or I'm thinking also about a family member who has some dental hygiene issues,
Hmm.
and there's just very cursory care with
Yeah.
it that's leading to just not great breath that you just don't
Right.
want to be around. And part of me wonders, to kind of cut through the bullshit a little bit and
Right.
get to what's the holistic picture of this human.
Hmm.
And part of me wonders, oh, it's just this like lack of motivation, lack of care, lack
Hmm.
of yeah, lack of self-care,
Sure.
self-worth. Or is there kind of more of a let's like push people away because I don't want to be seen
Hmm.
or something along those lines?
Hmm.
But yeah, like how you do one thing is how you do everything typically.
It is.
So the maybe this speaks to my not not anxiety, that's not the right word, but just the meticulous care that I take
Hmm.
with my mouth. I try to do that with all kinds of things, my nails,
Yeah.
you know,
Right.
my clean, like I try to clean certain spaces.
Well, and then you need sometimes some help because
Yeah.
this is not uncommon for me to have people that come for help who have been diligent, doing their very best, taking time and energy the best they know, and they're still having disease, oral
Mm,
disease, cavities, gum disease.
yeah.
And sometimes that's the most challenging situation is
Right. Because they're wondering, what am I
they're,
doing wrong?
that's right. I'm doing everything right. I'm doing everything they told me. I'm doing everything I know to do.
Yeah.
And I guess we all face those things in our development,
Mm.
health wise, career wise, life wise,
Right.
relationships. Like, I think I'm doing the best and it still sucks. So what? I need help.
You only know what you know. You don't know what you
Exactly.
don't know.
Yeah.
So there definitely has to be a level of self-compassion, I think, from all fronts, for sure. For
And
sure.
then, yes, and then connectivity. That's what we're all here for because none of us can be the knowing of everything except our most highest power. Nobody is going to know all of it.
Right.
So
Right.
submitting to the help from another with more expertise and then fostering connections like, I mean, I feel so grateful to be talking to you today because we add elements that the other doesn't know.
Hmm.
We can't. You'd have to live a million lifetimes
I know.
to try to know every single thing. All the fronts of being a human on this planet. So,
Yeah.
um, yeah, I'm grateful that we have a chance to connect.
Me too. Me too.
Hmm.
I want to bring up one more topic
Hmm.
before maybe starting to wrap things up.
Sure.
I'm curious if you have experienced in your practice a level of ancestral dental trauma.
Hmm.
And I'm thinking about, because I was talking to my mom on the phone also after the whole
Hmm.
ordeal, and her sisters, herself, my grandma, all had a lot of malnourishment
Mm.
coming back, or not coming back, coming to the States from Cambodia.
Mm.
They were prisoners of war essentially
Wow.
and had one bowl of rice to have a day. That was it.
Jeez.
They lost their teeth, some of them.
Hmm.
my grandma has a full set, top and bottom.
Mm-hmm. Mm-hmm.
That's actually causing her some discomfort right
I'm
now.
sure.
You know?
Yeah.
And yeah, I was telling my mom how crazy to think that, these are three lineages or three generations
Okay.
of dental
So your mom, your
stuff
grandma.
and me,
Okay.
right? And I told her
Mm-hmm.
my goal is to not prevent necessarily, but yeah, let the trauma stop with me here,
Sure.
you know? But yeah, just curious if you've seen that in your practice or have heard stories.
I definitely have, and it goes both ways. So I've heard, I've had many people who come in who are very afraid and very skittish, but it's actually not from their own experience because of one of their parents who
Mm,
had a high degree of um, anxiety around dental care. So they're trying to walk this young offspring into this world of accepting dental care, and they're full of anxiety, and they're saying things like, it won't hurt, it's going to be fine. Well, why would you even say it won't hurt? Like, this little person doesn't even have hurt in their mind.
right.
So there's a lot of well-meaning things from somebody who's had this trauma, and they're trying to usher their next generation through it.
Mm,
um, that can be detrimental, and it almost, you have to reprogram some of that.
totally.
um,
Totally.
and on the other hand, I've seen it where, you know, parents are really have had great experiences, and they're ushering this youngster through a great esteem about their mouth. And here's the things I can do. And we eat well, and we take care of ourselves. We take care of our mouths. And it's part of being a healthy human being. And that's always inspiring to see as well.
Yeah. Oh,
So yeah.
I love that.
I love these little tykes that I see sometimes, and they just come in and they're like, "Yeah, look at my teeth, and how are you today, Dr. Dickerson?" And um,
Oh.
it's so I get to see all the spectrum.
What's the youngest that
Mhm.
you've seen for their first time? Actually, I don't even know the answer to that question. Like, when are you
Mhm.
supposed to go for your
Yeah.
first dental visit?
So I don't, at this time in my career, I don't treat children, but I
Uh-huh.
have certainly treated
Yeah.
thousands and thousands over my career. But I always feel like age 2, when they're toddling around, is a great time to introduce them.
Mm,
And it granted, the parent needs to be looking in their mouth, seeing what's going on. If there's any signs of warning with teeth that look brown, or signs of any distress from the little youngster about pain in their mouth,
yeah.
that needs more immediate attention. But when they're 2, they can have an experience of positivity no matter how far you get to an exam, and just
Gotcha.
start to have it be a part of their life,
Yeah.
that I go to see this dentist and the people that work there, and it's fun, and we get to, and then the parents cleaning their teeth, the little youngsters getting used to, like, submitting to opening and letting somebody else help them.
Mm-hmm.
You
Mm-hmm.
know, it's not natural necessarily.
Right.
So if they get indoctrinated early to trusting people, and you keep them with trusted people,
Yeah.
they usually can get off to a great start, and then catch any problems before they get to be severe, you know?
Totally. It's
Mm-hmm.
reminding me just thinking about having a child feel so safe and supported in exploring their mouth. I could see
Yeah,
a lot of kids being like really like, ah, get away from me. My brother
right.
was very much like that, especially with blowing his nose. He hated blowing his nose
Oh
because
gosh, who
he had a
know?
deviated septum. But
Really? Okay.
have you seen the kids on whatever social media
Hmm.
and the parents are doing the neti pot kind of stuff,
Okay.
like
I don't think I've seen that.
squirting? And I'm so impressed by some of these children and how
Yeah,
open they are to, they seem to not necessarily enjoy it, but they're definitely open to it. They don't
right,
look like they're being forced. Their parents sound sweet as heck.
right.
you
They
know?
don't feel traumatized.
Right, right.
I felt some of the dental work that I've done on mission dentistry in Honduras, and there's these darling orphan Honduran children that come into the clinic, and so many of them, and I don't know, their influences are just different.
Mm.
Their psyche's different, and most of them just they're these little brown-eyed, brown-skinned, adorable cuties, and they just go and they sit still and they want the help and they hug you when they're done.
Wow.
So I don't, there's so much that goes into it.
Yeah, yeah. A
Hmm.
level of gratitude I can feel
Hmm.
for sure. Just like
Yeah,
thank you for helping me.
right. And even if you had to poke them or hurt them, they could tell that you were kind
Yeah.
and you loved them, as a human and you were trying your best. And
Yeah, exactly.
hmm.
Exactly. Oh, that's so good.
Hmm.
That's making me, yeah, excited to, well, I don't know why, but it's making me excited to try to indoctrinate a child into
Yeah,
good dentistry and
yeah,
good oral hygiene and self-love and self-confidence and appreciation for this face that, like you said,
right.
it is our front, literally front-facing thing that we meet the
Hmm.
world with.
Yeah.
So
I mean, and
important.
it's part of our DNA. There's a part of our brain in the temporal region. It's the fusiform face area,
Hmm.
and it actually is the area of our brain that has learned facial identification, all the nuances. Like even when somebody gets a nose job, how do we still know that's that person? Like
Right.
there's so much detail
Mm-hmm.
that our brains have accommodated to learning facial recognition. And so for sure, the teeth, the mouth, the lips, the smile are part of that.
Yep.
And
Yep.
from a DNA level, we know that it's critical for identity.
Hmm. Hmm. I'm not going to go into this necessarily. We don't have to go into
Mhm.
this at all, but it is, I feel like, maybe worth mentioning. I feel like I
Mhm.
follow some people who speak on the changes made to the face, even via Botox and fillers.
Yeah.
I've never talked about it on the podcast here before,
Mhm.
and I have friends who do it. I have friends who don't.
Sure.
Feel both ways about it. Um, but just from a nervous system, facial recognition
Hmm.
standpoint, and being able to express your true emotion, it is quite
Hmm.
interesting to note those changes for yourself and then maybe how the outer world is receiving you. But
Hmm.
same goes, right, for your teeth and the willingness
Yeah.
to show your teeth and open up your mouth and
Yeah.
use your voice, you know?
Exactly.
Yeah, very interesting
So like
experience.
my 14-year-old daughter who had the most microscopic chip, somehow there was a danger signal in her that this makes me unacceptable.
Right.
I can't go on with life if this until this is normal again. So yeah, I think it can be very powerful.
Very. It is
Hmm.
powerful. Absolutely. Wow. I'm gonna have to, for lack of a better word, munch, chew on
Yep, you do that.
a lot of what we've spoken about. And
Yeah,
I'm so grateful to be connected to you and have these open conversations, reflections,
yeah.
with
I
something that
feel the
is,
same way, Brittany. So are you going to get your final crown soon?
yes, next week on
Awesome.
the 12th.
All
So,
right.
right before Valentine's Day, right before I'm giving a workshop and
Mm-hmm.
talking about sex and
Right.
intimacy. And yeah, it's going to be a cool one. So, I'm going to be happy with that, I think, just having my permanent
Mm-hmm.
one in there. It was so cute. Actually, I'll mention how the dentist that I'm working with has a specialist, like a lab guy
Mm-hmm.
who does all the color matching, and he had me come in
Sure.
person to take pictures. And
Uh-huh.
I was just genuinely so happy that he was someone who looked like he was living his purpose. He was so excited and giddy to find the right match for my
Yeah,
tooth. I was so appreciative that he was
that's
taking all
awesome.
that time and effort. And yeah, he was
Mm-hmm.
genuinely excited about making this tooth. So I feel
He
like there's
gets
already
it.
so much love like poured into the
Yeah.
process, and yeah, that it gets to be poured back into me. So
Well, you should send us a little post when you get your
I
tooth
totally will. I totally
because
will.
that's a great day.
Yeah, yeah,
And
absolutely.
it's not necessarily the final step, but it's a huge step of healing and accepting the help of others.
Right, right.
Hmm.
Okay, well, where, if you wanted to shout out anything
Hmm.
for you, your practice, anything new that you're up to?
I'm really just tunneling down into the people that find me that really need what I'm here to do.
Cool.
So definitely people that are dealing with barriers to their dental health related to trauma is one of them.
Mm,
People who have been stuck in a spiral of pain related to their jaw joints and their headaches and their bite. That's something I'm very passionate about. I've spent a long time learning about.
I find that stuff fascinating, actually.
Hmm. And on the biological dental side, I'm always interested in helping people understand what's actually in their mouth that may be contributing to chronic inflammation,
Hmm.
chronic disease,
Hmm.
and helping them figure out priorities for moving forward. And so those are the things that my practice really focuses on. And when I get to work every day, Brittney, I love it. I just love the interface with my patients. And we laugh, we cry, we think, we
Hmm.
do stuff. I have to coach them through difficult things. My team is right there to support everybody through the different steps that are involved. I really feel like there's a big light that's shining down on our practice right now
Hmm.
and gracing us with the ability to help, not the world, but help certain people.
The ones who are ready for it.
Yeah, and who want that help.
Totally.
So that's kind of what I'm up to.
Amazing.
Most of where people find us is just with my name, Sharon Dickerson. There's Sharon Dickerson DDS, and um, so if somebody's looking, that's pretty much how you find us.
Perfect. I'll make sure to
Hmm.
put all that information in the show
Thank
notes.
you.
Yeah, of course. Thanks everyone for listening and tuning in to this week. We'll see you next time.
All right. Thanks, Brittney.